Brian, thanks so much for joining us.
My pleasure. Good to be here. Good to talk to you again.
Yeah, I'm excited to see you again. It's good to catch up. And I'm excited because we're going to talk about Bamboo Health, which is a company that is disrupting the healthcare industry by revolutionizing care collaboration. So, what does that mean?
Yeah. So the problem we're going after is, in healthcare, if you're sick or you're elderly or you have a substance abuse issue, behavioral health issues, you're seeing a lot of different providers. And unfortunately, those providers, clinicians, care managers, et cetera, don't work for the same organizations. They have different software systems, they have different incentives, they're in different geographies. And it creates this sort of mess of like disconnected, siloed healthcare. And that drives a ton of cost. It decreases quality. It's a terrible, in many cases, a terrible patient experience. The good news is there's a lot of people out there that want to fix this problem. There's a lot of care managers that want to support these patients and treat the patient, in a whole person way. But they don't have the tools to do it. And so at Bamboo Health, we've built a platform of products and data and networks and workflow tools to really help address that problem. And like you think about a financial manager or a stock picker who has all of this amazing real-time, exciting data at their fingertips to make really high quality decisions. And they do that really well. And unfortunately, healthcare clinicians don't. They don't have that. And so we're trying to solve that problem. It's a big problem. Depending on how you count it. I mean, this issue is in the hundreds of billions in terms of the costs associated with it. So we're excited to be able to try to affect that.
And it's a very there's a lot to this platform because there is the patients, there's the collaboration of the different care providers, but it's also the insurance companies are involved too, correct?
That's right. Yeah. So we're at a great scale. We work with 44 state governments, every major payer, every major pharmacy, thousands of hospitals, tens of thousands of clinicians. And scale is really important when you're creating a network. I don't want to compare it to Facebook, but Facebook is really, really valuable, or any social network is really, really valuable because they have scale. Everybody's on it, right? And we kind of see the same thing. Like if there's only a fifth of the clinicians that are on it and they're not really collaborating, right? It's not really working then. So scale is really, really important to us.
So let's talk about the platform and a patient example. How does it all work?
Yeah, absolutely. And this is one of the things that I think is really, exciting about working here is, again, these very practical, simple, outcomes and results that we have. And we actually have in our Slack channel, we actually have a memorable quotes channel where we post quotes from customers that talk about how our products have really helped patients. One story we had recently, we actually did a case study on it. It was a woman in North Carolina who had some mental health issues, some substance abuse issues. And her son, unfortunately, died of an opioid overdose exactly a year prior. And she showed up at an emergency room, in crisis, having a major panic attack. And she had gotten off of medication. She had stopped getting mental health services. And when she hit the emergency department, we sent a ping to her nurse care manager at a company called Monarch down in North Carolina, who was trying to care for this patient. They found out that she was in the emergency room. They were able to get in touch with her and then kind of pull her back into some of these mental health services. And it was really nice. She had a nice quote. The patient had a really nice quote in this case study about how, without that notification and without that outreach from her nurse care manager, she'd probably be sort of spiraling down. And so these things happen, all the time, where there are people out there that want to help and will help, but they can't do it if they don't have the data, if they don't have the tools, if you don't have the network. So, we're thrilled to be able to do that every day.
So what's the history of the company, Bamboo Health, if people aren't familiar with the brand? How did it all come to fruition?
Yeah, absolutely. So there was a company called Appriss that had owned a few companies. They were a holding company that owned a few sort of data analytics companies. One of them was a healthcare business. It was called Appriss Health. And they ran prescription drug monitoring programs for about 44 states. And then through acquisition, they added in some behavioral health products and things like that. but a great company in its own right. And Appriss decided that the companies, each of those companies that they own, might be more valuable independently as opposed to as a group. And so around that time of that realization, Appriss Health was looking at Patient Ping as a potential acquisition target. That's where I was working. As you recall, I was the CRO there. And they thought by bringing together two customer bases, networks, assets, we can really create that scale that I was talking about. So I think it was last June, the acquisition went through. And then a few months later, we combined the two companies and then spun it off as what's now known as Bamboo Health.
So once someone does join the team, what's it like working there? What's the day-to-day culture like?
Yeah, it's funny. I always struggle with like the culture question, because it's like, it's not, I forget who it was saying like your culture is not what you want it to be. It's like what it actually is. And it's these millions of little interactions every day that sort of come off as someone's perception of what it's like to be at this company. So with that caveat, I will say, our leadership, our management is very humble. Rob Cohen is the CEO, and then Jay Desai was the CEO of Patient Ping, prior, as we brought these companies together. I think like we've, so I would say humble, mission driven, ambitious, growth oriented, fast moving. And I think we've hired and promoted kind of consistent with that, right? And such that the culture then has been shaped by the much larger management team. For that reason, I think it's a pretty good place to be.
Brian, thanks so much for taking the time to walk us through all the great things happening at the company.
Awesome. Thanks, Keith. Great to see you.
Well, I hope you enjoyed this video. At VentureFizz, our mission is to share the stories of companies, their people, and culture. So if you're interested in more interviews with founders and executives in the tech industry, make sure you click on the subscribe button. Thanks so much for watching.